acyclovir. Then you have the valacyclovir. So what we should know about this is that they have the same mechanism of action. First of all, when you look at valacyclovir and acyclovir, for them they have the same mechanism of action. But but we group them. There are those that work on simplex and then the cytomegalovirus. So for valacyclovir and the ganciclovir, for them they inhibit the action of they inhibit DNA synthesis by inhibiting the DNA polymerase enzyme. So that is the mechanism of action of all. But in addition,
is an aboard acyclovir. We call it a prototype, meaning that it is the first one to be manufactured. And other drugs have higher bioavailability compared to acyclovir. That's why they are given and then they are converted into what? Acyclovir.
okay. Then the acyclovir and valacyclovir. Okay, pharmacokinetic of acyclovir. Because we have talked about the mechanism of action, now we have the PK. So for the acyclovir is the poorly absorbed when given orally and has a bioavailability of 15 to 30%, then excreted well. In addition, excreted in the kidney as the acyclovir. Okay. Then the indication of acyclovir, we have simplex, we have double herpes, and we have simplex 1 and 2, we have double herpes, and then the genital herpes. So you can either give it for treatment or prophylaxis. Then for valacyclovir, it is the same mechanism of action, the same indications. But the reason why sometimes we give valacyclovir, for it, its pharmacokinetics is somehow different from this one. Because this one, valacyclovir, for it is rapidly absorbed when given orally. Rapidly absorbed when given orally. Then it is then it has a higher bioavailability than acyclovir and excreted well. In addition, excreted in the kidney. Then, being that they have the same mechanism of action, they have almost the same side effects. Where we have the skin rash, abdominal pain, confusion, photosensitivity, and then you can add the NVD because they are given.
Now, one unique thing about acyclovir classes, they are nucleoside analogs, first of all. Because for you to understand DNA, their effect on DNA, that means they are competing with the normal nucleoside we have in our body. So you find out that yes, they inhibit bio-DNA polymerase, but we need to know what polymerase does because you want to trace your mechanism. When you say bio-DNA polymerase, it becomes a naked one. You need to trace it. Now, What I wanted to say about them, when he's talking about side effects, you don't know the structure. But when I say nucleoside, it paints a picture about what it contains. It has a sulfide. Always remember. That's why I started with nucleoside. And it has an S. That will give you about 3 side effects even before you start. Photosensitivity, hypersensitivity, and allergic rash. Even before you start thinking about any other side effects. It having an S in the structure, because when you look at the structure of DNA, you will see that it has an S where you're joining the phosphate to the nucleoside or something, nucleoside body. But one thing that you should note, acyclovir, ganciclovir, valacyclovir, they all have an S in their structure, so they will present side effects that are similar to penicillin, that are similar to sulfonamides, which will include hypersensitivity and you can continue.
So we have finished these ones, and now we can move to this one. So this one also has the same mechanism of action. But the reason why we are excluding it, for it has different pharmacokinetics, and it has somehow different side effects. Contribution for pharmacokinetics. Poor absorption variability. Then administered orally, excreted in urinous, acyclovir. Then for its side effects, we have that we have skin rash, we have constipation, depression. Then this one, ganciclovir, has its how they call them? Contraindications. Has its contraindications. To say that when you have prescribed ganciclovir to a patient, maybe that patient is a man, you advise the patient to use condoms, because this ganciclovir has effect on spermatogenesis, and effect on spermatogenesis would lead to congenital abnormalities. So even the women must use contraceptives, and even when we are breastfeeding, we have to advise the breastfeeding mother to discontinue the baby from breastfeeding for a short period of time during treatment. So that is all.
So in a nutshell, which side effects? So which side effects should people take?
Concentration, depression, fever.
Oh. Thank you. I think
on addition,
they are targeting simplex virus. And then we said ganciclovir is targeting the cytomegalo virus. So we are now looking at, he has brought a very good point that is going to help you as a prescriber. HSV1 is targeting the mouth, okay, oral region, the respiratory tract, if you may say, to give you a good take from the mouth, esophagus, whatever it is. Now, but the other is basically targeting the genital region and meninges, that is HSV2. Okay? So it implies that which of the drugs is more potent in management of, for example, viral meningitis or genital warts? We said ganciclovir is basically on cytomegalo. So that means it has no role here. So now the thing is between paracyclova and acyclova. That's one thing that you should think of, that should be stimulated in you. I know the answer, but I'm going to send you to Ghana. Okay, just to save time, you will go for paracyclova in cases of genital or biomeningitis. And when you go for it, though I haven't seen it in your discussion, one of those two drugs is a prodrug. Anyone who saw it in that group? Which of those two drugs is a prodrug? Gansarco. As? Yes. Now, that is going to redefine your presentation a little. Why I wanted to bring it forward is that yes, ganciclova has an indication towards cytomegalovirus. However, it is not fueling the drug of choice there. Why? Because we know at the back of our mind that ganciclova is a prodrug which can be converted to acyclova. And we have seen acyclova can target HSV1 and HSV2. It implies that if I'm answering an MCQ and someone asks me, the following is true about ganciclova, one of them will say it's a prodrug. Absolutely right. He may tell me it is used to manage cytomegalovirus only. That would be wrong. Because it is going to be converted to acyclova, and we have seen acyclova can cover HSV1 and HSV2. In fact, for resistant genital and viral meningitis, the drug of choice that we go with would be ganciclova. And right now the market is about 750,000 per vial. So if someone is resistant, the tablet goes for I think 75. If someone is resistant to acyclova initially, he comes back with this genital, what you have done, the RCT is negative. Think of ganciclova. Why are you thinking of ganciclova? Because it is a prodrug. We know what a prodrug is. If you don't know, you can remember, you can make you remember. Let me see if I can get one person. Hassan, where are you? Hassan. It did come to you. Musema Hassan. Hassan did come. What about Sue? None. She did come herself. Esther, in group 2, she's around. Esther, what is a prodrug? That's what you would say. A drug that changes to what? Every drug changes when you take it, apart from a few. Now that is where the point is. An inactive drug taken into the body that upon metabolism it turns to active. So you're not failing because you don't know. You are failing just because you don't want to pass. Because you know what is right. Okay. Now, knowing that this drug is going to be inactive, ganciclova is not inactive. It implies if someone sets an MCQ and says the following is true about ganciclova, and he says, hey, it is an inactive drug, that is right. It is a prodrug, it's not active. Upon metabolism, it's worked on to become acyclova. Now, what I wanted to bring forward, why use it for resistant infections, which are basically genital and biomeningitis, it's because the concentration of that drug will increase once it is worked on. So you get a bigger bioavailability compared to acyclova. Hope it is clear. You get the concentration can't be big. Choice of words is very important. It is high. Yes. When you say the concentration is big, then you are talking about what is the weight. We will ask you what is the weight of that concentration. If you say that it gives you a big concentration, we ask how many kilograms. It has to be high. Okay.
Okay, we want